And of course, second years are joining. They've been into field work, so they'll be joining as they travel and things like that. Okay, so you can start.
I understand. I have myself been there as a student, so
Oh, that's
I do
lovely.
very well. Okay. Good morning, everyone, and a very warm welcome to all the participants joining us online for today's webinar. My name is Mahima Chadha, and I am honored to be your host for this special event, which is jointly organized by Dementia India Alliance and the Prasanna School of Public Health, Mahe. As this webinar is part of the World Alzheimer's Month, today's webinar is titled as Developing a Dementia-Friendly Society, Role of Social and Healthcare Professionals. As you all know, Alzheimer's and other forms of dementia impact millions of individuals worldwide, and challenges are faced by those affected, uh, and then it is taken care by the professionals. Before we begin, I would like to express our sincere gratitude to all our esteemed speakers and participants for taking the time to join us this morning. We are delighted to have healthcare professionals, social workers, students among us today, working towards building a more dementia-friendly society. We encourage you to use the Q&A box at any point during the webinar to submit any questions that you may have. Now, it's my pleasure to introduce our distinguished panelists who bring a wealth of experience and diverse perspectives on dementia care. Our first speaker for today is Ms. Aarti. She is a physiotherapist with a passion for elder care and a deep commitment to improve the lives of individuals affected by dementia. She is currently the lead of teledementia and training at Nightingale Medical Trust. Good morning, ma'am. We welcome you.
Good morning.
The
Thank you,
second
Mahima. Good morning, everyone.
The second speaker for today is Ms. Chippy. Chippy Sebastian is a psychiatric social worker currently serving as the clinical coordinator and lead in DEM Clinic at Dementia India Alliance with 11 years of experience in dementia care. Welcome, Chippy. You're on mute, Chippy.
I'm sorry. Yeah. So thank you so much, Mahima, and thanks for the opportunity.
The third speaker for today is Mr. Abraham. He's a psychiatrist at Kasturba Medical College, Manipal Academy of Higher Education. Welcome, sir.
Thank you so much. Thank you for giving this opportunity.
We are truly fortunate to have such a dedicated panel who will help us understand how we can shape our society and healthcare system to better support people living with dementia. To begin, I would like to invite Mr. Terry Andrews, the Associate Professor and Head of Department of Social and Health Innovation, Mahi.
Thank you, Ms. Mahima. Just a quick clarification. It's Dr. Abhiram, not Abraham. He's a very good friend and colleague of ours. And so very good morning, ladies and gentlemen. I'm glad to share a few of my thoughts as opening remarks in this webinar. Definitely, all of us have heard this word dementia, and dementia is considered to be a global public health concern, given the rise in dementia cases due to aging populations. Across the world, all societies are looking for ways to support those who are affected with dementia. And in fact, societies struggle to meet the care needs of people with dementia and the burden that the families experience when they care the older people with dementia. And in India, if you see the estimates, close to 9 million older adults above the age of 60 have dementia. And the prevalence is higher in rural areas than in urban areas. Given these figures, the challenges in dementia care is multifaceted. To name a few, burden experienced by caregivers. I've witnessed myself and I've experienced myself in providing care for my grandmother who had dementia. So to what extent it kind of takes a toll on the physical, emotional well-being of the caregivers and also a huge economic burden. And stigma faced by those individuals and families in the communities are another concern that need to be addressed. So devaluing of these persons with dementia and their families, just because they have dementia, memory loss, caused a lot of feelings of embarrassment, isolation, and marginalization. Thirdly, it's the lack of access to quality care, particularly in low and middle income countries like India, and highly inadequate workforce in aged care. So, if you see the predominant location of dementia care facilities, it is all located in urban areas. But whereas the prevalence is much higher in the rural areas. So that's an important concern that probably, we need to think about and discuss. How do we reach out to rural areas? And fourthly, it is also the financial strain that the dementia care causes on the system, health system, and the families. So this includes if you see the long-term care cost of individuals with dementia, it's quite expensive. And recently, I was discussing with three people who are running the dementia care facilities. They are charging close to 60,000 rupees per month, so which is quite exorbitant. And also, the public health systems are always or most often underfunded, and the families also bear high out-of-pocket cost for care. Unfortunately, insurance companies does not cover the dementia care services. And if we look at the aged care literature, it predominantly talks about, two models of care. One is the home-based care, and the other one is the residential care model. Given the challenges and complexities in dementia care, it is highly crucial, I think, we need to go beyond this binary and design social and community-based care models for dementia and intervene at different levels. Start from, of course, we can either start from policy, get down to the personalized care, or probably start with personalized care, then go up to, designing programs and larger community-based services to policy. It is to this end that Dementia India Alliance and Prasanna School of Public Health, Mahe, joined hands to take this work in dementia care forward. As a start of this progressive collaboration, we thought we will do a webinar to discuss the way various stakeholders contribute to creating dementia-friendly societies, particularly the role of social and healthcare professionals in developing a culturally sensitive, community-based dementia care services, which also addresses the needs of caregivers and families. I would like to conclude with a saying, from small beginnings come great things. Here, DIA and PSPH make a small beginning to make societies dementia friendly. Hope you all enjoyed the webinar. Thank you.
Thank you, sir. Thank you for sharing the opening remarks, and thank you for sharing the current challenges that we are facing and addressing the various stakeholders. Now let us move on to our discussion. We have a few key questions that our panelists will be addressing today, and I'm sure their insights will be valuable to all of us. So the first question is, how can communities, policymakers, and organizations contribute to creating inclusive environments for people living with dementia? I would like to invite Mrs. Aarti to start with her thoughts on this.
Thank you, Mahima, and thank you everyone for this great opportunity. Am I audible to everyone?
Yes, ma'am.
And is my screen visible?
Yes, ma'am.
All right, thank you. So I think the previous speaker gave a lead about, everything that is required in a community, especially a developing country like India. So I'm going to talk about inclusive environments for people living with dementia, the contribution from communities, policymakers, and organizations. So when it comes to communities, I think lots of awareness campaigns are very, very important. So Dementia India Alliance has organized a program called Dementia Friends. And for students, it's in the name of Dem Champs, where, lots of people, irrespective of their field of work, whether they belong to healthcare or they belong to engineering or any other profession, the main agenda is to spread the awareness about dementia and remove the stigma that is there currently in the society, especially in the rural sectors, people still believe that, dementia is some sort of a mental illness, or even some sort of black magic is being performed to the elderly, or it is their personality itself because of which lots of behavior changes are there. Whereas the proper diagnosis of dementia is not very, very common especially in the rural sectors. So, when you talk about the statistics on how many cases of dementia has been diagnosed, right now in India, we have around 88 lakh people diagnosed with dementia, whereas in 2025, the number is set to reach around 1.7 crore. So these are only the diagnosed cases, and there are a lot more cases which still remain undiagnosed and do not have access to proper healthcare management systems. So I think awareness campaigns are very important. Support groups. Support group involves lots of healthcare professionals plus family carers, where each of them do some sort of a hand holding when people are lost in caring for people with dementia. So DIA organizes lots of support group meetings for lots of family carers who have day-to-day challenges, like how to give them a bath, or how to help them wearing their clothes, or even smaller chunks like how to give them medicine, or what is to be done, how to handle this behavior, or what sort of support systems are available in the community. I think through support groups, there will be a lot more help available across the community for family members exclusively for of people living with dementia. And social inclusion. So once a person is diagnosed with dementia, unlike other medical issues like cancer or AIDS, the support that people with dementia get is very, very less, considering their poor judgment abilities and lots of cognitive impairment. Because of that, they are not at all included in decision making. There is something which is very important for all of us in life called quality of life, where we decide what is important in our life and we decide what to do for our life. Whereas when it comes to people with dementia, since their capacity to think and judge is lost, as families or as healthcare professionals, we do not focus on including them in our day-to-day decisions. Simple decisions like if they are sick, where are we supposed to go? Are we supposed to go for a treatment or just rest at home? Or what color clothes are they supposed to wear for today? Or what would they like to visit for that particular day? So this is very important, especially in a community which is not at all dementia friendly, where people are unaware about dementia. It's very difficult for them to plan an outing, even for a meal, or just go for a movie, even in the milder stages of dementia. So it's very important that cafes, restaurants, malls, libraries are all dementia inclusive, and they provide some specific environmental changes which can accommodate people with dementia. Similarly, accessible spaces like transportation. Our public transport systems are not, safe enough for people with dementia. So they do not have proper signboards. Even us, when we enter some of the metro stations, we find it very difficult to track our route, how to move from one blue line to the green line, or how to move from one transit to the other. When a person with cognitive impairment enters, even in the mild stages, I think it's very, very difficult for them. They may lose their track at any point of time. Community resources, lots of directories. Currently, I think in India, lots of resources are available for people with dementia. But then, is it accessible for everyone? No. So directories are very important so that they can reach out for help whenever needed. For example, where are the memory clinics located? What sort of insurance is applicable for people with dementia? What sort of hospital systems are supportive? Or which doctor to consult for diagnosing or managing people with dementia, or what sort of mobility aids are important. All these things are very, very important. So policymakers, legislation, develop laws and regulations that protects the right of people with dementia. So I don't know how many of you are aware, there's something called as the Mental Health Care Act of 2017, and we as an organization recently registered under the Mental Health Act. The main agenda of the act is to protect the rights of people with mental health issues, and dementia is also considered one of the mental health issue. So when people, as I already mentioned, when people do not have, no longer have the ability to judge and, decide what is right or wrong for them, there is high chances that their quality of life might be compromised. So getting restrained, getting tied up, or not being denied of their rights even like, not giving them enough food or not giving them water on time when they ask for or not able to ask, everything is very, very important. So to prevent all this type of physical and verbal abuse, there's lots of legislation and laws passed for supporting people with dementia. And I think recently, Karnataka government also announced dementia as a public health priority. That's something we should really, really welcome. So funding, not more of funds are allocated for dementia research, care services also. When you see in the community also, there are not much of, daycare facilities, residential care facilities, or even memory clinics set up. So funding is one major chunk where, people, families caring for people with dementia are finding it very, very difficult. And dementia research is something which is happening worldwide, but not up to the mark. It's not at all enough. In India, it's like very, very low. So I think funding is very important to continue with the research. Training programs, it's not only important that healthcare professionals get trained, even general public and police and other first responders also have to get trained on dementia awareness. So I would like to quote an example here. One of the carers tried to take one of the people living with dementia to our daycare center. So when they were commuting on the way, the person exhibited some sort of a behavior issues where he refused to come to the daycare center. Unfortunately, when one of the police saw them, they actually, misinterpreted that the carer was trying to kidnap the elderly person. So then the family had to intervene and say that the person was diagnosed with dementia and that was one of his behavior issues that he was exhibiting, and he was taken safely to a daycare center. So to avoid such incidents, it's very important, for people in the community to get trained about dementia awareness. Urban planning, integrate dementia-friendly principles into urban planning. We who do have lots of people living in the apartments. So once and people living with dementia get missed very often. So they get lost in the community. It's very, very difficult for us to track them later. When there are safe environments, when there are proper gating systems, when the security in all the apartments are being trained, and when the neighborhood also understands, it's very easy for us to give them a good quality of life and ensures safety for them. So as organizations, resource development is one area which we could focus on. So create and distribute materials that provide information on dementia. So as organizations, Dementia India Alliance is also working on spreading the word about the awareness of dementia. We do have lots of materials for the general public, for healthcare professionals and the other people also, which provides me lots of resources about dementia, not only about the diagnosis, about the management, about the care, about advanced care planning and everything. And collaborative initiatives partner with local communities for lots of volunteering and interning opportunities. So we as an organization also encourage lots of volunteering, especially for kids and the students, so that we also have a scope of intergenerational bonding activities, which the elderly really do enjoy. And innovative care models are also into focus. So there's something called the person-centered care. Usually in hospitals, people focus on the disease rather than on the person. So the treatment is completely disease-oriented. Whereas when it comes to dementia, there's something called the person-centered care approach, where we put the person as the focus, not the disease. So what is important for the person, what the person likes, what the person dislikes is all considered, and a care plan is produced based on which the further care is being enhanced. So research and evaluation, it's very important that organizations focus on research and keep evaluating whether they are doing the ideal thing, which is supporting individuals with dementia. So I'd like to pen down few across the world what's happening for people with dementia. So in Netherlands, I think most of us should be aware that there's some village called the Hogwijk village, which is the world's first dementia village, which was opened in 2009. So it's known for being inclusive, person-centered, and breaking the stigma of dementia. When you see in the picture also, they have a community set up within a private space. You have the grocery store, you have the post office and everything. So that's very important to make them feel that they are in their own homes. So this is one Villaggio Emanuele in Rome. It is which is in Italy. that's based on the design of a historical town or village. It aims to improve the quality of life for people with Alzheimer's, and it's a very dementia-friendly environment in Rome. So Japan is always an inspiration for people across the world. So here there's a lot of scope for people living with dementia and their partners working towards eliminating stigma and discrimination. I don't know how many of you have heard. There's a cafe for people with dementia where they are being employed. So people who come there to dine do really enjoy even when wrong items are being served for them. I think that's the success of empowering people with dementia to involve themselves in lots of occupational activities. So in Latin America, there's lots of research going on, and there are lots of dementia stories for impact voices around there. So in Taiwan, there was something called the Run Tomo, which is a program that brings together people with dementia, community residents, and others to create work opportunities to meet their occupational needs. And then there's something called dementia-friendly business, which is across Asia and Europe. This particular slide is from Singapore. There are these metro stations where every station has a dementia go-to point. So whenever there's a person goes missing, even the public do have that much awareness, wherein they can mobilize the person to a dementia go-to point and easily locate the family members and reach out to them for help, immediately hand them over to the family members, even if a person with dementia loses his way. So to summarize everything, so ideally, the supportive community is something which has residential and daycare settings, lots of memory clinics planned, not only in the urban areas, also in the rural area, and should be a dementia aware and responsible legal and financial planning. So it should have lots of interning and volunteering opportunities with welcoming and supporting faith communities, and supportive options for independent and assisted living for people with dementia. Ideally, everyone's focus, even for us, it is rather than bringing them to a confined space where for daycare and residential care, it is very important that the person gets to live with his own family in his home till the last. So dementia-aware local government services, planning and emergency responses, especially when it comes to hospitals, I think it should be completely dementia-friendly. Nurses, doctors, caregivers, everyone should have training on how to handle people with dementia, even during their sickness. And business with dementia, informed services and environment for customers and employee caregivers, dementia-friendly public environments, and accessible transportation. Yes. Thank you.
Thank you, Aarti ma'am, for explaining us how all these collaborative approaches can, make a real difference in the lives of people with dementia. Let us now move on to the next question. Next question is, how can social and healthcare professionals collaborate to provide holistic, person-centered care for individuals with dementia, while also addressing the need of caregivers and families? This is a critical aspect of dementia care, and I invite Mrs. Chippy to share her views on this topic.
Miss Mahima, if I'm correct, I think this one is by Dr. Abhiram. Is it right?
Yes, Professor Teddy. My topic was different.
Yeah.
Okay, that's fine, not a problem.
Sorry.
Okay, so the question, good morning, everyone. So the question given to me was the best practices around the world in developing dementia-friendly communities and how we can adopt this to India in our making sure that the sustainability, cultural aspects and everything is taken care. So that was the question given to me. Is that right, Mr. Teddy?
Yes.
Okay. Thank you. So my colleague Aarti beautifully explained what a dementia-friendly community should look like. A dementia-friendly community is a place where a person with dementia get respect, they're accepted, they're understood, they're getting the support they require. And moreover, they feel they are part of the community. So to get that, they need some support, like there should be enough awareness in the society. People around them should know what dementia is and how to treat them well. There should be a proper support services for people with dementia as well as for family caregivers. So the main area of focus for a dementia friendly community is going to be, first, as I said, awareness. Then there should be a social inclusion, challenges and stigmas to be um, taken care properly, and there should be a proper care and support system. So this is a model which is followed in other countries. Even in India, we are trying to adapt this only. It's a what to say? It's a group of people. All of us together has to work. It's not only NGOs or government has to do, including the local business, other organization, hospitals. Everyone has to work together. So Aarti already give you an idea about the practices in some countries like UK, Japan, Netherlands, Rome, and all. So I would like to give you a brief idea on few countries. So in UK, they have comparatively, Europe is much ahead in caring for people with dementia. So they have a concept called dementia-friendly community on giving more comfortable life and a quality life for people with dementia. They got community engagement and awareness programs, even business and other services like dementia-friendly hospitals, other concept also there in UK. In Japan, they have a community care-based model, and Aarti already give you a brief idea on the activities they're doing there. They're also having support system for family caregivers. The neighbors are supporting them in the caregiving journey, because it's not a one-day process. It's 24/7 caring. The caregiver is also going through a lot of stress and difficulty, so they need a lot more support. And they have even involved in using technology for monitoring and supporting the person, like monitoring their sleep, monitoring their movements, fall prevention. For those things also, there is technological support which we can use. So they're even focusing on those things. And Canada got an initiative called Dementia Friendly Canada Initiative. So they are also focusing to include people with dementia as part of the community and make them feel more comfortable. And they're also doing a lot of awareness program and community-based programs. So all this, okay, there is one more country which I would like to discuss, which is Australia. In Australia also, they are trying to put up together the things based on their culture, how they can support the person and how they can um, build a dementia-friendly community. So when we are talking about all these countries, the main focus is going to awareness, training, support service, and obviously you can see involvement of government in all the activities here. So once it comes to India, we need to understand that in India, hardly 10% people get diagnosed with dementia. Aarti already mentioned that there is 8.8 million people in that is only 10%. Many of them doesn't get diagnosis because they're not aware. Most of the time, dementia is misunderstood as normal aging. It's a part of normal aging. That's what people think. And we in India, we got a problem that people are always hesitant to ask for help when it comes to anything related to our psychological thing. For physical condition, always people go in front and ask for help. So we should bring a concept that mental health is as important as physical health. So for that, to create this awareness, we have to use simple language, local language. We should have materials in local language, and we have to explain in such a way that people can accept it. Just like, for example, we can always compare dementia like diabetes. Diabetes need a lifetime treatment. Dementia also need lifetime treatment. So this will bring, this will reduce the stigma. This will help us to reduce the stigma and also help us to get a better acceptance in the community. In olden days, diabetes was considered as only foreign people get it. But now in India, diabetes is everywhere. It is just common, like anyone and everyone can get it. So that way, if dementia also get acceptance in the society, that can help us to create a dementia friendly community in much easier way. Once we create awareness also, we need a lot of services. When people understood, okay, there is a condition called dementia and we need to seek support, then they should have a guidelines on where they are supposed to go, where they'll get support. So in India, like in the opening time, Professor Teddy has mentioned that in India we got services, but only in urban areas. Majority are in urban areas. To rural areas, we don't have much. So we got a lot of things, but it is not equally spread all over the country. If we take Bangalore as an example, Bangalore, we have Dementia India Alliance, we have Nightingale's Medical Trust, NIMHANS is there. So we have a lot more programs here. We got daycare for dementia, people with dementia. But when we get some calls in our helpline, when we tell people about daycare facility, they're like, we don't have access. Otherwise, they'll say it's around 25 kilometer, 30 kilometer, 50 kilometer far from our place. So how we will take that support? So once we
Ms.
don't
Chithi,
have,
sorry to interrupt. I think your slide remains still in slide number 5. Are you moving the slides or?
yes, okay, I'm so sorry.
Maybe you can reshare. Let's see.
Are you able to see my slide now?
Not yet.
Okay. Now?
Yes. Yeah, if you can make it a full screen.
Is it full screen now?
But that's okay. I think it's quite clear enough. But I saw you're clicking it, but it's not coming on. Yeah, that's okay.
Okay, I'm so sorry about that.
No, that's okay. Please carry on. Yeah.
Okay. So what I was saying is people should have accessibility to the services. So one or two, like in Bangalore itself, if we take the count, we'll be having different organization together. We might be having 8 to 10 daycare centers. So that numbers need to increase. Even the residential care facilities, even the doctors or other professionals who are involved, there should be more number of people involved with us and more facilities available for that. Also, to support the family caregivers, we should have different services, like if a person with dementia in a rural area, if they need a nurse at home to support them with the caring of that person, it's really difficult, it's really challenging to get someone in certain areas. So that need to get more focus. Number of day memory clinic need to increase, because if we need to screen more people and give help to more people, memory clinics should be there for that diagnostic support. So involvement of government is very, very, very crucial in this case, because the number is not less. One or two people or a group of people together try also, we will not be able to make much difference in that. So involvement of government is very important. As Aarti mentioned, in Bangalore, we were able to achieve that with a great effort from NIMHANS and Dementia India Alliance. now dementia is a healthcare priority, a public healthcare priority. But in other states also, these kind of initiatives should come up. The state government or the central government has to get more policies. And we discussed earlier, there is no insurance for people with dementia, and there are a lot more difficulties we are going through. So we have to get help from the government for improving these scenarios. And also, we were talking about whether the hospitals are dementia friendly, whether our surroundings are dementia friendly, difficulties with transport, Aarti already mentioned. So all these things need to improve. For improving that, government support is also very important.
Ms. GP, again, I think it's the slide is still 11, but I think, yeah, probably you can move ahead to 13.
Okay.
Yeah, now it's visible.
Okay. Yeah. So to improve that, now I can see that we have a lot of social workers here. I'm also a social worker and I'm working in this field from many years. So I can see that a lot more opportunities are there in the field. So more people has to come, more professionals to be there. So we all together can work together and we can make a dementia friendly communities in India also, which can give better care, better support, love, respect to people with dementia and their family caregivers. Thank you, everyone.
Thank you, Mrs. Chippy, for explaining us about the best practices. And now we can move on to the next question, which would be taken up by Mr. Abhiram, if I have spelled his name correctly this time.
Yes.
Can you pardon me for the mistake I made previously?
Sure, sure.
But
Definitely.
the question for you would be, how can social and healthcare provide holistic, person-centered care
Yes.
for individuals with dementia, while also addressing the need of the caregivers and family? A very, very important question.
Hope my slides are visible.
Yes, Dr. Abhiram.
Yes. So let's picture this. This was a study that was conducted somewhere in 1990s, somewhere 3 decades before. Imagine two groups of people with dementia. Both have almost similar degree of clinical stage of the disease. Both are at the same stage. Around 10 of them are staying in one residential care facility. The other 10 are in the another residential care facility. So this group A had a structured routine. They had their family members and friends visiting them regularly. They had almost 4 to 5 hours of activities per day, which included music, relaxation, a lot of other activities based on their personal interest. And they also had routine nursing care, medical care, and regular checkups. So this was in one of the residential care centers. The other residential care centers also had similar type of care, but the activities were not structured. Probably they had reading or some entertainment, but it was not as structured as in the first group. But other than this, the regular checkup, the medical care, the nursing care, everything remained the same in both of these institutions. And interestingly, the researchers, they followed up both of these group after a couple of years. And what they found was in the second residential care setting, the progression of condition was more severe than the first. Even though at baseline, both the conditions, the clinical staging and the stage of dementia was exactly almost similar, but the progression was more severe in the second residential care setting. Probably this was the one of the pioneering study that broke many myths surrounding dementia. So with that outline, I would like to start my addressing the question that is given to me. That is person-centered care for people with dementia. How social and healthcare professionals can collaborate in assisting the people with dementia and also the carers and family members. So two of the earlier presenters, they presented wonderfully about what are all the different ways with which the earlier questions can be addressed. Probably now I'll briefly focus on what is person-centered care, and then probably we can understand how we can collaborate. So there is an overwhelming tendency to make brain the center of attention dementia. This particular pathology, Alzheimer's disease is there, or Parkinson's disease is there, or say vascular dementia is there, and we want to make brain as the central attention in dementia, but much of the focus is about the sufferer. It's about the personhood or the person who is suffering from dementia, and it's not just the brain. So clinical presentation of dementia is far from just being just related to the neurological or disease impairment. It is a didactical interaction between the neurological impairment, the individual psychology of the person, the social context or the social psychology, what we call it as social psychology. It is the environment with which the person is staying. These dynamically interact with each other, and it gives rise to symptoms of dementia and its complications. So as we know, dementia has cognitive symptoms, it has functional limitation, it has behavioral symptoms. It cannot be directly equated to the disease of the brain. It's the personhood in dementia that is most important. So we know what is personality or personhood. A neonate which is born after the delivery, after many years it turns out to be an adult. So this process of getting a significant identification in the society, it's what we call it as attainment of personhood. This involves social interaction, it involves early life experiences, it involves environmental learning, so many other factors. So ultimately in the adulthood, the person reaches this personhood, and this will remain more or less frozen. It keeps on interacting with the surrounding, with the intimate relationships, and progresses throughout the adult life also. So the fundamental assumption that the neurological illness or dementia impairs this personhood is itself is false. Even with advanced dementing illnesses, the personhood still can be intact, the person can still be intact, and the care addressing this person can actually improve the outcome also. So that is how we should change our outcome towards a person-centered outcome rather than just illness-related factors. So that is briefly about person-centered care. So there is a lot of evidence to support that much of our knowledge about dementia is based on this social interaction or environmental interaction. So many times we diagnose somebody with Alzheimer's disease and say that okay, maybe the life expectancy of this person is just 5 years or 6 years. We often are proved wrong, because it is possible that person can achieve stabilization. There can be dementia from dementia based on the environmental interaction when person-centered care is integrated. So that's what the important message of person-centered care is. For all those who are interested, you can look into the works of Kirkwood. So he was the pioneer in understanding dementia care in a totally different setup, where he pioneered with a person-centered model for dementia, and it has gained a lot of importance now. I'm sure that's also being incorporated in many of the organizations that are working in this way. So the idea is that we need to look the person in his environmental context, his life and his uniqueness of his experiences context, understand him as a person, and then probably understand dementia. So it includes the sense of personhood, includes self-esteem, sense of agency, that is everybody ability to control their activities and feel the purpose of life, their connectedness with the surrounding environment, their family members, their friends, their community, their interdependence with each other, all matters most in functioning. So the main focus here is on the person and how care delivery should center around them, and not about the disease or not about the disease process. Each individual is unique. We need to understand this, and probably the cognitive assessments that we do on a scale or some structured assessment are just numbers. They just show us that this is the upper limit which a person can perform, and they don't necessarily equate to their function. So they might score low or zero on a particular cognitive scale, but they can still perform many activities in their home. So we need to understand this. The priority should be on understanding the person, reducing the environmental barriers, and improving the ability of the person. This forms the core aspect of person-centered care. If you want to understand person-centered care, we also need to understand some of these aspects, like what is dementia. There are different subtypes of dementia: Alzheimer's dementia, vascular dementia. There can be mixed dementia. There can be dementia due to other neurodegenerative conditions. Having an understanding of how these disease processes progress, what will be the first symptom, what will be the progression later, will also give us an idea as to how this might affect each individual. We also need to look into personality, because some of the behavioral manifestations, some of the cognitive disabilities can also be due to the pre-existing personality factors. If we understand the personality factors better, we can plan the care better. So we need to also know the context, the biography, who stays with the patient, what is the relationship, the biographical aspects of person is also needed. Then we also need to look at health status. It's not only the dementia, like in old age people, it is possible that most of them also have comorbid medical conditions, diabetes, hypertension, joint problem, ambulation difficulties, hearing difficulties. So we need to understand their normal health, general health status also. Then look at the neurological impairment and also the social context in which they are living. So not able to perform driving, not able to perform skilled navigational tasks might not be relevant for a homemaker. Somebody say Yellamma or Venkama who is staying in Karkala remote village, it might not be relevant for them to know how to drive, know how to do the routes or how to do advanced calculations. For them, most important is how to manage cooking, how to support family. So that makes most important context. So understand the social context is also very important, because like I said before, there is a didactical interaction between the neurological process of the disease process and the environment. So this forms the fundamental tenets of person-centered care. Here, idea is to enhance abilities, promote independence, and as much as possible to plan a care which is person-centered, and it is not from a generic evidence. So how can social and healthcare professionals collaborate? So as we all know, dementia includes different number of stages of management. Say it can be prevention, primary prevention or secondary prevention. It can be early identification of those with cognitive difficulties. Then once it is identified, getting them to a specialized services so that they can assess the cognitive disability or assess what is the disease process. Is it reversible condition or irreversible condition? Once that is done, how to plan the care, who will look after the person, what is the support available, what is the community resources that is available. So that is something is need to be done in collaboration. It is not possible by neurologist, psychiatrist, or general primary physician, or social worker, or clinical psychologist, or community worker alone. It's a collaborative model that is needed. So how do we work on this? So basically, the role of social workers, role of healthcare professionals, role of nurses, role of clinical psychologists, all have their own importance. It can be transdisciplinary. It need not be that one role is interchangeable. It can be transdisciplinary. By having adequate training in assessment, support, and basic degree of crisis management, we all can share our roles. And when necessary, we can specialize, refer them to specialized professional to give specific inputs. So basically, like I told you before, it is possible to have when you make a diagnosis of dementia, as much as the cognitive diagnosis, it is also the psychosocial assessment that is primary importance, because the symptoms or disability is manifesting because of environmental barriers. So a psychiatric social worker or a social worker or a community worker can do a proper psychosocial assessment that can give us the amount of burden one is going through. There can be psychoeducation, which can be done at community level, to know about the cognitive symptoms of dementia, to know about the functional abilities of dementia, to know about the behavioral and psychological symptoms of dementia. Because behavioral and psychological symptoms of dementia, they produce most of the caregiver burden and distress. So educating the family, that is also done by social workers, done by community nurses, done by community workers, or anybody who collaborates with the care. So supporting the caregivers. So the caregiving is a journey. It's a very tedious journey. Among all the disorders, the caregiving distress is highest in dementia. That's what many researchers also say. So providing adequate support for the caregivers, educating them, having a supportive session with them, or being available whenever they need during the time of crisis or uncertainty also improves this. So again, this also can be done collaboratively by social workers and mental health care professionals, or even general healthcare professionals. So provide educational resources, connect them with community resources. Like say, a lot of wonderful work is done by Dementia India Alliance, Nightingale, many other trusts in India in collaboration with NGOs, in collaboration with government. But the person living in Manipal or living in Malpe won't know about this. So putting the family with community resources available, giving them resources so that they can meet up with the local resources, all those things are needed in the collaborative care. So maybe one point in this journey would be diagnosis in the initial setup, but when collaboration is there, definitely this journey would be more comfortable for the family and as well as the person suffering from dementia. So developing a comprehensive assessment and also developing a person-centered care whenever it's feasible, collaborating with social as well as healthcare professionals will enhance the outcomes of dementia care as well. So I'll just briefly present some of the framework of person-centered care which we can all incorporate. This is irrespective of mental health care or is it healthcare professional or social work professional. The principles remain caring, person-centered approach. So primarily the first step is to foster relationship. Whenever somebody comes with dementia or early cognitive symptoms, we need to make a very good rapport with the family, rapport with the patient or the person who is suffering from dementia. So empathetic relationship, respectful relationship, this relationship should be built on mutual trust and honesty. So we should always communicate with them properly about the diagnosis, how much ever we know, how much about whatever the uncertainty we know, whatever uncertainty we have about the prognosis, we should communicate to them honestly. And we should also validate their feelings. They might have a lot of concerns about the diagnosis. We might have to validate their feelings initially, and also we should respect their met as well as unmet needs. So next would be to provide adequate information. Probably at one setting it might not be sufficient. This is a continuous process. Psychoeducation or education is a continuous process. We might have to give them access to materials, access to education about symptoms, challenges, cares, what is the end of life care, what are the different stages, all those information we need to provide them continuously. We need to address their emotions, both emotions of the family members, emotions of the caregivers, emotions of the person diagnosed with dementia also. They can have anxiety, they can have depression, they can have uncertainty about the diagnosis. We need to support them. We need to address the emotions of the caregivers also, and we need to address their burden and caregiver distress also. And somehow many times the diagnosis will be uncertain with a lot of constraints related to financial constraints or the diagnostic challenges. We might not have a clear-cut working disease model. It can be just dementia, we don't know the cause. During that time, we need to communicate this uncertainty. We need to tell them that we are available during the periods of uncertainty. There can be health status fluctuation. We need to tell them we are available for hospitalization. We need to tell them, prepare the family for uncertainty in the future. We might also have to plan them for respite care or institutionalization also. And this decision is always shared decision making. So it is not one-sided decision from the healthcare provider or the community worker or the social worker. It is both. Patient is involved in this decision. Family is also involved in this decision. If this is a shared decision, definitely the outcome would be much better. And as much as possible, we need to enable self-care. As much as possible, more routine activities should be promoted. As much as possible, promote the independence of activities. It's always, family members sometimes do this. They know that person is going through difficulty, cannot take bath, he forgets. They'll try to take over that and help the family, give the patient bath. Instead of that, if it is possible, promote independence till whatever extent it is possible. That also promotes person-centered recovery. So caregiver support is also one of the essential aspects in this question. This is one of the common experiences. What do caregivers experience? It can be formal caregivers or informal caregivers. Most of the time it is the daughter-in-law, wife, or informal caregivers. They might feel that they don't have enough time for themselves. They might feel that they're frustrated, they're strained, they have their own health sufferings. They're uncertain about what to do. They don't know how to help the person. They feel that they can do better, they're not doing enough. They might feel sad, they might feel anxious. They don't know what to do about the behavioral problems. They feel that they have lost control over situations. It is also possible that in Indian context, they feel that they have to endure this burden. They cannot share it with others. They keep it to themselves. So this kind of stoicism can also lead to a lot of caregiver distress and burden. So what can we do to improve the caregivers, their functioning, their well-being? We can discuss with the caregivers, educate them about dementia. What are the different stages? What are the different symptoms that can arise at various stages? What are the options available for treatment? We can mobilize the support. They can inform other family members. They can also pitch in once a week or once in a month to care for this thing. During that time, the primary caregiver can get a respite. They can build awareness about the education about dementia. The support groups helps. So more than doctors or mental health professionals, the caregivers know much more about how to manage the behavioral problems. So having a weekly support group and discussion can also help. One example is Alzheimer's Disease Related Society of India, Mangalore branches there, where they regularly meet. Dementia India Alliance also holds a weekly meeting where they regularly meet and discuss. Family members tell what they did to particularly address one particular behavioral problem. That helps. it is much more helpful than just theoretical knowledge. Then financial support. Unfortunately, we don't have insurance support like somebody mentioned earlier. If possible, at policy level, if mobilization can be done to improve insurance coverage, that also helps. Some personal time for caregivers, if they can focus on their activities, their health, some respite, that also improves their caregiving burden also. These are all some of the steps that we can do to improve caregiver support and also to provide person-centered care. So just to put it in a nutshell, it's the person. It's not the illness. It's not the Alzheimer's dementia. It's not the Parkinson's dementia. It is the person. It is Mr. A or Mr. B who is going through this difficulty. He's much more than just the cognitive disability or the behavioral symptoms he has. He or she, with his family members, determine the problem by creating person-centered care or creating activities that are meaningful for that person. We can enhance this. Just not by just giving some cognitive training, do letter cancellation or grain sorting at home. It should bring meaning to that person's life. It should cater for the emotional need of the person, not to the family. Then the outcomes will be much better than what we traditionally expect. Thank you.
Thank you, Dr. Abhiram. I think you've done a wonderful job at explaining us how everything comes together. The framework looked amazing. I think the best way to put it out and to explain people. And I think the experience of family caregivers, it's very important for us to understand. Only then we can do something about it. Right.
Yes.
Thank you to all the speakers for sharing such valuable information with us today, this morning. And we will now open to take questions. We would like to address as many as possible.
Hi, can you hear me?
Yes, please.
Yes. So you spoke about person-centric care, but wouldn't you say something like caregiver's burden is more important? There's often the situation where a family member is caring after somebody affected by dementia, and that just takes a toll on them, and not a small one, a heavy one. So what is this partnership or this new venture that we all are going together, going to look at this?
Anu,
Is
please
this
just
question
direct
for
to
Dr. Abhiram?
Dr. Abhiram. I'm sorry, to Dr. Abhiram.
So I'm sorry, your question was about how do we address the caregiver burden and this thing?
Yes.
I'm sorry, I missed
do you
your
have
question.
any-
Can you please repeat?
So often the thing is caregiver burden is something that we are not focusing much on. Yes, the person-centric, the person who's affected is the person who's being looked at. So other than psychoeducation, what else can be done for a caregiver to make that burden lighter? Is there any program? Is there anything else that can be done?
Yes. So, like you pointed out, it's a valid point because much of the times in a clinical or routine, this thing we focus on the person suffering from dementia and we generally neglect the caregivers. But when I discussed about this model, it's the personhood. It is not just the person, the people surrounding him, the family, everything is involved in that personhood. So, when I say somebody with dementia, the person-centered care also involves the family members, the surrounding, not just the single person who is suffering from dementia. So, like you said, yes, during the initial part of the evaluation, much of the emphasis is on identifying what cause of dementia it is, what is the progress, and everything will be focused. Majority of the focus will be on the person who is suffering from dementia. So, one important evidence-based, intervention for caregivers is also psychoeducation. Psychoeducation is often degraded as what is there, just giving information about dementia. How can it change the caregiver burden? Because a lot of uncertainty will be there about understanding of symptoms, how the symptoms will come from. Say somebody, I'll just give you an example. So imagine somebody experiences hallucinations as a part of dementia. So the person during the evening hours, the person start experiencing that somebody is coming and trying to kill him. We call it a sense of presence and sense of presence. It's a common visual hallucinatory experience. By educating the family members, by also educating them about these are all transient experiences and they are not permanent, by changing some environmental modifications in the home, we can also educate the family that you need not get anxious or get distressed when your family member experiences visual hallucinations. By family member reassuring them, distracting them to other aspects, the symptoms would come down, right? So most of the times it is non-pharmacological management. By educating the family members, we can enable them to care for some of these behavioral symptoms better. That will reduce their burden. So this is one aspect. Second aspect is availability. So traditionally, our healthcare systems are built in such a way that they have to come for follow-up in the OPD. We can only meet them in person. There is no scope for telephonic follow-up. There is no scope for video follow-up. We can break that barrier. We can give our contact numbers. Whenever there is a crisis, they can call us and discuss with us. Even if it is not possible for us to give immediate solution, they can at least vent their emotions. We can validate their feelings, and that makes them feel better, right? And by just giving them assurance that we are with them in their journey, a lot of things will also change. But of course, they have to go through this. It's easy for us, all of us, to say, do this, do that. I'm sure like Teddy sir was mentioning, he had as one of his family member, close family member with dementia. The journey is one's own. We cannot replace it with any of these things. But supporting the journey and staying with them, supporting them during their uncertainties, and also mobilizing the local support available, that can also reduce the caregiver distress. So many of them also would not like to discuss this with others. They need to keep it with themselves. So encouraging them to discuss, vent their feelings can also help this. Maybe others also can share their experience.
So essentially something like a support group where
yes.
we get together, that will be also something.
Yes.
In your personal opinion, is that something? Okay, I'm sorry. Do John.
So just to add on with what Dr. Abhiram has mentioned. So we have support group meetings online now. Recently, we started online so that it can be accessible anywhere. Along with Nimhans, we are doing support group meetings every Saturday. This is a free thing. Any family caregiver can join. They can discuss with their problems and they get, I'm not saying they'll get a solution for it, but some challenges that some families would have got a solution for it. So they can share whatever their experience. More than we as a professional, they will be knowing better because they are the people who are dealing with them. So sharing their experience and hearing from experts and all help them to improve their knowledge and make their caregiving more easier. And this daycare concept we mentioned also is like it's also for supporting the family caregiver. When their dear ones are at the daycare in safe place, enjoying their activities and meaningfully doing things, family caregivers are getting a break from their caregiving thing. So they get some time for themselves. And we also have a helpline, which is handled by professionals where they can call. Anywhere in India, they can call and seek help. Family caregivers, when they have this burnout, there is a high chances for elder abuse and other problems also. So if they are in trouble, they can always call and check if there is a challenging behavior, how to handle it. If they themselves feel like they are exhausted, how to come out of it. So those kind of helps are also available now, but this is not enough. We need more.
Thank you very much for clearing that out.
Any more
I'd like to,
questions for us?
Mahima, sorry, I'd like to add on to that also. I think it's more than psychoeducation and, other resources available. It's very important that we give some sort of counseling for family carers also, initially post-diagnosis, they might find it very overwhelming, the decision of, caring for a person with dementia, for their loved one. There is lots of, something called role reversal, where the child becomes the parent and the parent who is affected with dementia becomes the child and completely dependent for even the basic activities of daily living. That's where lots of counseling is important, and it is very important that we insist on engaging them in their own personal hobbies also once in a while. Taking a break from this caregiving journey is also, there's nothing wrong about it because family carers usually experience this guilt wherein, they take decisions of leaving them in a daycare or residential care. we should ensure that they come out of that guilt and spend some time for themselves, for their own well-being, so that they can continue the journey without any hardships at all. And we do also offer something like respite care. So whenever the family members do want to take a break, whether they want to go for a vacation or some sort of an outing, or even when there's something in the family, we can always support by taking care of the person living with dementia for a short period, and the family can go refresh themselves and come back and continue the journey of caregiving. Yeah. Thank you.
Thank you. Any more questions for us?
Ms. Mahima, I think there is a question in the chat box from our PhD scholar Abhijit. I'm not too sure if you're able to see, but I can read. I think this is a question for Abhiram, Dr. Abhiram. The question is, how can we strengthen support networks for informal caregivers, which is kind of addressed. And I think to ensure they receive the emotional as well as financial support they need. So of course, the emotional aspect has been addressed and the financial support, if there is any. And also, do we have any support from government for the dementia patients?
Yeah, so unfortunately, right now, like most of them pointed out earlier, insurance is not covering most of the hospitalizations or crisis. This thing, it's not covering even the assessments or evaluations also. So again, it is tricky because I can tell my experience from Kasturba Hospital, because if somebody gets admitted under neurology, Ayushman Bharat or other government insurance that provides the care, but not in psychiatry. So there's still a lot of organizational level, policy level discussions that are going on. Probably, hopefully, in another 1 or 2 years, things might actually be fruitful towards this thing. So other than that, for dementia, for the diagnosis or for the journey, I don't think right now any government provision is there. So again, it is in the informal care setting, in the unorganized, those in the other pockets of the society who don't have access to specialized dementia care services. Again, it is all informal. There is no formal support from the government or from the any of the assessments. It is possible to link with district mental health programs, community visits. They have care at doorsteps, where it is possible to provide some kind of assessment or support at the doorstep available. They can reach out to the family whenever there is a crisis. They can farm a visit, but again, the numbers are the tip of the iceberg, and it is still very difficult. So what we do generally is improve the network. If it is possible, we link it up with the district mental health program, with the local psychiatrist. We provide the referral to them, tell them that this is the diagnosis. These are all the probably consultations that might come. We also put in touch with the social workers with the available network, and probably we try to mobilize the support. We'll also talk to the family members. If other family members are around or local community members are there, we'll talk to them. We'll try to mobilize the support from their network. This is what we do. Probably other members can also elaborate on other financial support that is available. So I think the other two questions were addressed before, the emotional needs and also the nursing needs. Like
Yes.
Hathima pointed out, it's the continuous support counseling that needs to, it's not just one time, it is to be a continuous process.
Ms. GP or Ms. Aarti, would you like to add to any information regarding financial support for the family members?
Unfortunately, there is no much financial support available right now, so there is nothing to be.
Wonderful. I don't see much questions there, so I would like to probably pitch in. Since Dementia India Alliance and the Nightingale Medical Trust has been pioneering in dementia care for many, many years. So I would like to probably request you to share your thoughts on or experience on delivering dementia care services in the rural areas, or if not, then what are your plans?
So from Nightingale's Medical Trust and through Dementia India, we are currently working on conducting lots of memory screening camps in the rural areas. So recently we started and we are like pioneering another project of ours in the outskirts of Bangalore, which is Dodbellapur, where we are like trying to construct a 300 bedded facility, especially for the underprivileged sector. So 100 beds are going to be completely for them. So as an initiative, we started this outreach program where we will be reaching out to, people, elderly people in the village, basically to conduct a memory screening. So as results, there's a set of questionnaire. So apart from memory screening, we also have the normal sort of questionnaire where people are asked if they have accessibility to healthcare. So if they have any memory impairment, or if at all they have anything, what sort of support they need. Unfortunately, or actually, fortunately, most of the answers turned out to be, they are all fit and fine. And even if they have any sort of problem, they do not want to, come to a setup like a residential care or daycare. Family bonds, actually, we should be happy about it in this busy lifestyle, where people are completely occupied with everything. There are still families who like are bonded enough to care for their own loved ones. One way we should be, I think, happy about it. And the other thing is actually there's lots of stigma which we have to break. Because people believe that, when they have access to, especially to residential care facilities, they feel that, there's lots of judgment in the society or the neighborhood saying, this person completely did not take care of the parent or the spouse at all, how much they should have done for them. But when it is time to give them back, they have completely ignored the or neglected the care for their loved one. I think that part it should be eradicated. So we are working on spreading more of awareness about dementia in the rural areas as well as the urban slums. I think that's one area which has to be covered because any sort of webinars or awareness programs, mostly we reach out to educated people only. Whereas people living in the urban slums and all are not at all being covered in any such programs at all. So we are trying to reach out to communities like this in spreading awareness about dementia.
Yeah, thank you. And I think that resonates with my research work, where I also discovered that the family members are keen to stick to the filial piety values, that we've been having it, and they really struggle to kind of balance, the care needs of the person with dementia or in either, health concerns, and also the kind of demands of the modern world. And then again, probably they are likely to have adolescents, so again, their demands. All right. So they're struggling to kind of balance this. Yes, Dr. Abhiram, for you.
Yes, just to wanted to add a couple of these are all the two initiatives by government of Karnataka also. One is Karnataka Brain Health Initiative. It's actually initially run by NIMANS. Now it has made all collaborators in all the district hospitals across the state, and they have created resource materials available online, including assessment, education, and also caregiver support materials available online, which is accessible to primary healthcare providers, the doctors in the PHC. So the second round of program will be also planning to conduct training initiatives for all of these primary healthcare physicians. So in that sense, that tackles the problem of identifying dementia and also using common screening tools in rural setup, especially at the PHC setup. Second thing is also district mental health program. Most of the districts in Karnataka have this program running. They periodically conduct training activities for PHC doctors and also the PHC community workers and ASHA workers about screening dementia, how to bring them to nodal centers where neurologist in the district hospital or the general medical officer in the district hospital can evaluate. So those are all the two programs which are being rolled out now. Probably in another 2 to 3 years, that program might reach the next phase. This might address the problem of identification and support of dementia in rural centers.
Wonderful. Yeah, thank you, Dr. Abhiram. I think Divya has some question or comment. Divya?
Yeah, thank you. I had a question just to ask Aarti madam. Uh, when you mentioned about the education and awareness that you are trying to reach out to the community, I was just wondering if you're reaching out even to the schools and colleges or.
Yes, in my very first slide, I did mention about the Dementia Friends and Dem Champs program, where we reach out to college and school students in spreading awareness about dementia, because those are the people who, tomorrow's community who will reach out to lots of elders on their day-to-day commuting to the school or colleges. So they
Okay.
empathize more with the elderly people when compared to us, what we've literally seen practically. So we do have programs for them also. And we are like trying to reach out to most of the colleges in and around Bangalore for Dementia Friends and DemChamps program. Thank you.
Okay.
Also,
Thank
we would
you.
like to invite you to Manipal as well. Oh, of course, Dr. Abhiram is here, so I will talk to
We'll
Dr.
be
Abhiram.
happy to.
Yeah, personally, and we'll see Dr. Abhiram how we can take this to the rural areas. But I'm sure, I think through your rural clinics you might be having some work happening.
Yeah. And also this DemCham program is not just an awareness program. It's a course for them to learn about dementia, understand there is an evaluation, and they'll be getting a certificate also for that. So if we look at our social work MSW course modules also, we'll be having a half page or 1 page about dementia maximum. So to be frank, when I came to the field, I never know much about dementia unless I started working with nightingales. So people should know that there is a lot of opportunity for them to come to the field. We need a lot more professional in the field. So this course will also give them an idea about what is dementia and how they can develop a career on that. So that is going to be one add-on benefit to the professionals also. I mean, the students also.
Yeah,
Students
thank
can also
you.
join Dementia Alliance group so that they can contribute in whatever capacity they can.
Yes, yeah. I think we are in the process of building more stronger collaboration. Yeah. Wonderful. I think there's one more comment. I'm sorry, Ms. Mahima. I think you're not able to see the comment. I'm sorry about that. There is Ms. Anu Mohan, a PhD scholar. Thank you very much, dear speakers, for the insightful sessions. Addressing the medical and emotional needs of dementia patients and caregivers is significant in ensuring holistic care. Are there sufficient digital initiatives to support people with dementia and their family caregivers? And what sort of innovations are further needed to strengthen the caring process?
I think Chippy can answer that question.
Yeah. So I've already mentioned a couple of things what we are doing already, which is one is the DEM Clinic platform, which is a free memory screening platform by Dementia India Alliance. So this will not stop people where they are, and they won't be reluctant to. Usually, you'll see to hospital if anyone get a memory-related problem or something. Always, they are reluctant to go to a hospital because they'll be thinking like, what people around me think. Will they think that I'm mad? So those kind of thoughts come first. So people always back out from those kind of thoughts. So this is a platform online which they can sit at their home. They need to have just a phone or a laptop with network. That's it. So we will do a screening through a video call, take a detailed history, and using different tools, we'll be taking an assessment for them, and we will give them a result, like saying like if they are okay, good to go, then we'll ask them to repeat it after 6 months. If there is a problem, we'll always advise them to take up a consultation. So we have a expert doctors panel also where who can help them through an online consultation. But again, when we consider about rural area, they got a lot of problems with that. They lack knowledge on how to use the technology and all those things. So that is again a challenge, but somehow it is, this is something better than having that, like someone can help them, their neighbors or children, or someone can support them and take up the service. But more people should know about this. And I also mentioned about the helpline. And the other online services is currently what we have is the support group meetings, which is on Saturday along with Hands. So these are the things what we are doing right now using the digital thing.
Thank you, Chippy. Thank you for answering the question. We're talking about how we are contributing and what is our plan going forward. There's something I would like to add, which is we have a MOU with the Ministry of Social Justice and Empowerment, where we are talking about, conducting screenings at the old age homes. Now, that is also one initiative which has come up in last few months, which we are looking at, because at old age homes, we need to create awareness. There are people there who are in need. So we are trying to see how we can work that out and, reach out to those people as well.
Yeah, that's a good way to work. Thank you.
I think we have now reached the end of our discussion. I would like to thank each one of you, especially our panelists. I think they have done a wonderful job at explaining and laying out everything in front of us, especially as the healthcare professionals. And I think in coming years, we are going to cater to a lot of people. There is a lot of need for us to be out there and reach out to many, many, many people in different ways that we can. Now, a big thanks to all of our participants. I hope you have taken something back with you today. Maybe it might not strike you now, but maybe later you'll remember something that you heard today, this morning, right? And we hope this session has given you practical ideas and inspired you to contribute, to this important cause. Uh, Let us continue to work together towards creating a dementia-friendly society that cares for everyone, those living with dementia, their caregivers, and their families. Thank you once again, and have a wonderful day ahead.
Thank you, everybody, for joining. Special thanks to the speakers.
Thank you. Thank you for the opportunity. Have a great day.
Thank you for the opportunity.